Thanks to centuries of scientific research, we modern humans think we have a good understanding of the human body and its workings. But is that all we know? Doctors made their best guesses in the strange case of Gloria Ramirez, but it still remains an incredibly terrifying and unexplained medical puzzle. The next time you experience pain or discomfort, you'll want to think twice about it. Gloria Ramirez, a woman whose internal toxins poisoned an entire medical staff, is still being studied today. In February 1994, unexpected complications from late-stage cervical cancer forced Gloria Ramirez to enter a hospital in Riverside, California. Despite her best efforts to combat the condition, her health was deteriorating, and she was slowly succumbing to its effects and the passing of time. Her visiting doctors and nurses were unaware of the otherworldly darkness she was experiencing after Ramirez, which was even worse than cervical cancer. And not in a fun, system-of-a-down kind of way. She was a walking human poison bomb. Not realizing anything was wrong, the doctors continued to treat the patients according to their usual procedures. However, after receiving some basic medical attention and taking blood tests, the area where the syringe had punctured her began to smell very strange. The medical staff initially ignored this and continued with their duties, until the hospital staff began to rapidly become ill and felt very ill. A situation occurred in which an unknown illness, or at least anything resembling an illness, was not apparent in the hospital. Loss of consciousness, coughing fits, and strange symptoms spread like wildfire through the unit. Before anyone realized what was happening, 23 people were showing symptoms. Several of these hard-working medical professionals had to be hospitalized for weeks. What specifically caused these problems? In other words, Gloria Ramirez had basically had symptoms of cancer when she was admitted to Riverside Hospital. The only difference was that no one knew exactly what was wrong with her. The disease she had was completely unknown, but her status as Typhoid Mary was almost certain. For months, reporters were fascinated by the story of a woman who had destroyed an entire hospital wing, and they frequently brought up the subject. Medical research has yet to determine the cause of Gloria Ramirez's illnesses, but much speculation about the case continues today. Gloria Ramirez was diagnosed with severe cervical cancer and was admitted to the emergency room in Riverside, California, on February 19, 1994. Ramirez was disoriented, out of breath, and her heart was racing. She also exhibited strange symptoms not typically associated with cervical cancer. Her tongue smelled of garlic and strawberries, and her skin was extremely oily. When a nurse injected her with an IV to draw blood, the room smelled of ammonia. Did most of the doctors think they were in the opening scene of a zombie movie? Shortly after a nurse drew blood from Ramirez, strange symptoms began to appear in the emergency room. Near the emergency room door, the nurse who drew the blood suddenly fainted, claiming that her face was burning. A medical assistant also fainted, shaking and gasping for breath. Other healthcare workers caring for Ramirez began to exhibit the same symptoms. A respiratory therapist fainted and lost control of her limbs. Several other staff members began to fall ill, forcing the hospital to declare an internal emergency. All patients in the emergency room were immediately evacuated to prevent further spread of the virus. If only Zach Braff had been there to provide a sympathetic voiceover for Fry to put these symptoms in context. All we can do is dream. One of the most widely accepted interpretations of the tragedy focuses on Ramirez's cancer treatments and their ability to trigger chain reactions that produce deadly gases. Ramirez is believed to have used the drug dimethyl sulfoxide, DMSO, to treat a variety of cancer-related pains and problems. This is because his system contained dimethyl sulfone, a metabolized form of DMSO. Since DMSO could have metabolized while the paramedics were administering oxygen, they are technically at fault. Even if this explanation were true, the paramedics would not have known what to do. The argument states that Ramirez's blood temperature had dropped significantly when he was taken in the emergency room. As a result, the dimethyl sulfone is converted into the deadly chemical compound dimethyl sulfate, which is then released into the atmosphere. Shortness of breath is known to be a common symptom of dimethyl sulfate poisoning experienced by those exposed. It is a theory that is not often believed that the personnel were poisoned because dimethyl sulfoxide was somehow converted to dimethyl sulfate. Many organic chemists expressed skepticism after this concept was made public, claiming that the complex chemical reactions outlined were unlikely. Although symptoms often take hours to appear, other studies have confirmed that most patients with dimethyl sulfate poisoning report tears. Ramirez's symptoms appeared immediately, and none of her medical staff had the wet eyes typically associated with poisoning. The medical staff at Riverside General Hospital did their best to save Gloria Ramirez. They strictly adhered to her treatment regimens for cervical cancer. Valium, Mazdolone, and Ativan were used to sedate the patient, and lidocaine and other medications were used to examine her heart. Ramirez's health continued to deteriorate even after nurses gave her oxygen using an ambu bag. As a last resort, electricity was used to defibrillate the woman's heart. Despite the failure of the technique, the woman was fitted with padded electrodes. Her body began producing strange compounds that affected everyone. Unfortunately, Gloria Ramirez died shortly after arriving at the emergency room. Her pulse was weak, and her blood pressure dropped. The medical staff gave Ramirez medication and electric shocks, but she still died at 8:50 p.m. that evening. She spent less than an hour in the emergency room before dying. Several online researchers decided to look into the mystery surrounding Ramirez's health. Some suggested that some of Ramirez's symptoms were similar to arsenic poisoning, because arsenic smells like garlic. Online researchers speculated that Ramirez may have self-medicated with fake treatments that contained dangerous drugs or visited a dubious doctor. And we can be sure that people on the internet are not always right. We can only know that if we know anything about them. Of the 37 employees, 23 showed at least one symptom of poisoning after Ramirez was admitted to the emergency room. Fortunately, most employees had only mild symptoms, but a few employees needed specialized treatment. Assistant physician Julie Gorinsky suffered the most, but nurse Sally Balderas had to stay in the hospital for 10 days due to sleep apnea. She had pancreatitis, hepatitis, and a bone-weakening disease that kept her in the hospital for 2 weeks. She was confined to crutches for months. In other words, the poison Ramirez released after the incident was very strong. Due to the unexplained poisoning, Ramirez's autopsy was conducted with great care to prevent the spread of the disease. The autopsy was performed by pathologists in special suits in a closed facility, similar to Fox's special alien autopsy. During the 90-minute autopsy, blood, tissue, and air samples were taken from Ramirez's body bag for examination. Gloria Ramirez's illness and eventual death caused a media frenzy. Riverside General Hospital was the focus of countless news stories as they tried to revive her, and the staff who were mysteriously affected by the fumes from her body became tragic heroes. People in California and across the country began to fear for their personal safety. Exploiting the public's fear of airborne diseases, many television networks aired endless programs about Ramirez's death. Ramirez's friends and relatives, angered by the publicity surrounding her death and believing that the hospital, not Ramirez, was responsible for the gas leak, gave interviews to several networks. The preacher openly blamed the hospital for Ramirez's untimely death during her funeral. He also criticized the county for not notifying relatives of the results of the investigation into Ramirez's death. It took nearly 2 months for Ramirez's body to be released for an impartial autopsy. By then, his body was severely deteriorated, his heart was gone, and many of his organs were diseased, making it impossible to determine an official cause of death. Ramirez died in February 1994, but his body was not ready for burial until April of that year. He was buried in an unmarked grave in Olivewood Memorial Park in Riverside, California. In the end, no one will ever know what really happened to Ramirez's body or what strange mixture of drugs and chemicals could have produced this completely unprecedented medical result, if, in fact, his body emitted dangerous fumes. As a result, given the amount of time that has passed and the public's lack of interest, even after all these years, a definitive solution is extremely unlikely. The only certainty is that the circumstances that led to these horrific results appear so unique that they are unlikely to recur. Hopefully, one day, medical experts will figure out how a combination of unfortunate events and luck allowed this mysterious disease to spread like wildfire in the spring of 1994. So, what do you think? Will the Gloria Ramirez case ever be solved? What was the real cause of the spreading disease, and how did the young woman suffer?